Hey, everybody, welcome to Pep Talk, the podcast that explores the latest in performance enhancing physiology, the latest in advanced testings, the advancements in therapeutics, and inspiration and motivation for you to take your life and your health back to the next level. I'm your host, Dr. Eric Nepute. I'm going to take you down this journey today. We're going to be answering some of the questions that you all have about health and wellness. So let's start unpacking these complex things and make it real simple. So let's get into it. This is a question today that we've got from one of our listeners. This is Mike from Chicago. And Mike asked us, he says, "Hey, Doc, I've been struggling with chronic low back pain for years. Are there any effective non-surgical treatments that you recommend?" Okay, Mike, we got a lot to talk about, brother. So the answer is yes. In fact, you most definitely want to do everything you can uh, to avoid back surgery. Most people that have had back surgery will tell you that the vast majority of people who've had it wish they wouldn't have had it, wish there was something else that could have been done. And long term, it just hasn't been as successful as they thought it would be. Sometimes it's the only solution. And I've had patients of my own that have come to see me for chronic back pain or chronic joint pain for other issues, and we've had to recommend surgery. But you try to do everything you possibly can until that is the last resort. You know, matter has limitation, right? And the longer you've had a problem and the more severe damage that's been done to the tissues you have, the more difficult it can be to regenerate that. So let's kind of go down some of the main causes of your back pain. Now, I need you to understand something. This is a health question, not just a back pain question. And if you understand that health is a balance of physical, chemical, and your neurological well-being. So there's three components to health. There's physical. You could have physical problems that cause back pain. We're going to go into those today. You could have chemical imbalances that cause back pain, deficiencies or toxicities, or even infections that cause back pain. And then the last piece is the emotional component. There is something known as emotional back syndrome. So what we need to do, first of all, is find out what's the root cause of your problem. You see, that's why I always say physiology doesn't lie. We got to test, not guess. And if you go, Mike, to the right practitioners that look at the physical, chemical, and neuroemotional aspects of your health, we can dial in, the true therapeutics to treat the root cause. So let's talk about physical problems first. I want you to understand that most joint pain, including back pain, because the spine is made up of lots of joints, can be caused because of imbalances in muscles. You know, muscles move joints, they protect joints, and they also help those joints have the energy that they need to have the hydraulics and the lubrication inside of it. And if the muscles are out of balance, that's typically the number one root cause of having back pain. What are the muscles that are probably out of balance? Your core muscles. So those are your abdominal muscles, the deep transverse abdominal muscles, your diaphragm, and your glute muscles. Look, if you have an imbalance in any of those muscles, those imbalances by themselves can cause serious issues. If you have, let's say, a tightness of the muscles in the back, it's usually because there's a weakness of the muscles in the front. You know, there's something called agonist and antagonist muscles. They're the opposites of each other. You know, the front has a back. Well, the reason why most back pain is there and because most back muscles are tight is because the muscles in the front are weak. So doing some simple core exercises, not doing sit-ups, but doing things like planks, bridges, those are very powerful things. You can go online right now and look up some very powerful exercises or stretches they're called McKinsey back exercises. And if you look up core exercises by McKinsey, there's all kinds of information on YouTube that you can go to, and putting those into play every day could be a very good beneficial thing for you to do. That's number one. Number two, there could be some muscle issues with your diaphragm. You know, when you breathe, your diaphragm is supposed to contract. Like what happens when we breathe, the diaphragm goes down, the stomach goes out, and all of our muscles are able to move in this just beautiful symphony of movements. Well, most of us are breathing with our neck and shoulders and not our diaphragm. So first of all, let's do this. All of you that are watching right now, sit up in your chair. If you're driving, don't do this, but sit up in your chair, put a hand on your chest and a hand on your stomach, and take a deep breath in. Go ahead and do it. When you breathe, what should happen is your bottom hand should come out, not your top hand. Your top hand shouldn't come up. If your top hand comes up, you're breathing with your neck muscles and you're not engaging the diaphragm proper. Well, because there are certain intrinsic muscles of your core and a big group of muscles called the psoas. If the psoas is off because the breathing is off, you're going to have bad back problems. There's a joke that we say in the doctor's world, and we're not too funny in the doctor's world. We say if you have a bad psoas, you're going to get a psoas, right? Because if the psoas is off, the back's going to hurt. So if you'll do some diaphragmatic breathing exercise, just again, go to YouTube and look up diaphragmatic breathing exercise. There's a technique that I really love called box breathing exercise. And if you can do the box breathing with the diaphragm in breathing exercises, that could help reset a lot of your back pain potentially. Start with those two things. And if that's not working, then find a personal trainer or even a physical therapist that can take you through some exercises and some stretches that can help you. Because stretching muscles like your psoas muscles, and there are ways to stretch that. Again, you can go on YouTube and look psoas stretches up, or you can get little devices like a right stretch that can help. And then also stretching out your hamstring muscles, your calf muscles, or even foam rolling those out could be a really good benefit for your back pain. There could also be some structural issues with the alignment and mechanics of your spine. It still to this day blows my mind how many people don't have a chiropractor that they see on a regular basis. I mean, everybody has a dentist and you brush your teeth regularly to try to prevent cavities in your teeth from falling out. Why don't you have a chiropractor? Everybody should have a chiropractor that they trust, that not only do they go and see whenever they've got pain, but they go see on a regular basis to keep their joints moving properly, because improper joint mechanics, if those joints aren't moving proper, causes dysfunction in the disc in the spine and something on the side of the joints called the facets of the spine. And those joints that aren't moving proper, or if they're stuck or out of alignment, that can lead to degeneration, inflammation, and pain. So I would encourage you to go find a chiropractor that can assess your spine and start you on a care plan to help reverse some of the damage that's been done and then maintain that the rest of your life. Again, going to a chiropractor is like going to a dentist. You go and you do an exam. They take x-rays of your spine like they would take the dentist of your teeth. They run some other tests to see what's going on with the function, and then they're going to set a course of care to fix the damage, and then they're going to put you on a plan to help prevent damage from happening in the future. They're going to give you some things to do at home, like back exercises and stretches and things of that nature. So go see a chiropractor, man, because that's a powerful thing that you can do. I always encourage people to do that before they go and do interventional work to their back, which you can, which are things like joint injections, anti-inflammatories in the spine. But I'm going to tell you the latest, greatest therapeutics that are out there are stem cell or exosome therapy that we can inject into those joints. It's amazing the regeneration processes that we can use if we put stem cells or exosomes into the joint space. It signals to the cells to wake back up. And many of you know that after the age of 30, we lose 90% of the production of stem cells and exosomes in our body. So it accelerates the aging process with us. So that's a powerful tool that you can use. There are other techniques that use lubrication therapeutics for the joints, the disc spaces, and the facets. We use something called platelet-rich plasma, where you can literally go and get your blood drawn, and we can spin your blood out, and we can separate the plasma, which is the viscous part of the blood that has, all the exosomes, your own stem cells, the collagen, and other proteins that help heal joint spaces, but lubricate those joint spaces and reduce inflammation naturally. Those can be injected right into those joints as well. That's a powerful tool to implement. What else can we do? I'm a huge fan of using peptides. There are lots of peptides that are on the market right now. I'm a big fan of peptides called BPC 157, Body Composition Protective 157. It helps the body regenerate its cellular function faster. It's amino acids, as all these peptides are. Amino acids come from protein. It's the usable form of protein in a certain sequence that has been proven to go to your cells and turn those cells back on. And BPC 157 can be taken orally, or you can inject it right around the area into the skin or the soft tissue around wherever you have pain in the body. And it's been shown to reduce inflammation and speed up the healing process. So those are things that you can do from a physical standpoint, right? What about a chemical standpoint? Did you know that certain nutritional deficiencies can cause back pain? Vitamin D and vitamin E deficiencies. D and E, two fat-soluble vitamins that are major deficiencies that people have on this planet today, can be causing back pain. So get your levels checked or start supplementing vitamin D. 10,000 to 20,000 IUs a day of vitamin D is a great place to start. Or supplementing around 500 to 1,000 IUs a day of vitamin E is beneficial to do. That's one thing you can do. If you have too much inflammation in your body because you're eating foods that are toxic for you, you're ingesting water that has chlorine and fluoride in it that's toxic to you, you're eating foods that have processed glyphosates on them, or red dyes or yellow dyes or anything that you can't pronounce on the back of the ingredient box, that could be causing an increased inflammation in your body and increased inflammation in the small intestine. And where does the disc in the back get its nutrition from? From the bloodstream, from the intestines. So if you have inflammation in your intestines from foods you're eating that are causing problems, or if you have an imbalance in good, healthy gut bacteria, that's going to cause the blood to be inflamed, which ultimately can cause the disc spaces to be inflamed. So literally your back pain can come from eating a high inflammatory diet, which is, processed foods and grains and, you know, sodas and juices and even alcohols. So if you'll go to an intermittent fasting food plan, eating more of a clean ketogenic type diet, or even a carnivore type diet for a short period of time to reduce the inflammation, avoiding things that have processed foods, especially breads, pastas, flours, rice, and grains, and alcohol and juices, man, that could help reduce your back pain. Did you know that you could also have toxins in your body of heavy metals that can be causing back pain? You could have toxins of overgrowth of bad bacteria in your GI tract that could be causing gut pain. Or to be causing back pain, or any pain for that matter. You can also have infections like, I don't know if you know this, but there's infections that are tick-borne illnesses like Bordella and Rocky Mountain Lyme and all these other things that are out there. These bacterial infections and funguses and spirochetes and other things can be causing chronic inflammation and pain with you as well. It's important to have the right testing done so that you know exactly what's going on with you. So from a chemical standpoint, those are just a few things that you can do. By the way, there's a lot of data that shows getting your vitamin C levels up can even reduce the risk of back pain, okay? Because the vitamin C, protein, vitamin E, and D make up the disc space in the spine. What about the emotional component? Did you know that there's an emotional component to chronic pain? There literally is something called emotional back syndrome. You can look it up. And it's when our emotions affect our body. Let me ask you a question. How many of you listening right now, when you get stressed out, feel it in your body? Where do you feel your stress? When I get it, I feel it in my jaw, the back of my neck, sometimes my knees. Those are areas that are the weakest links in my physical body. Because I've had my jaw broken. I've had my neck injured through playing football in high school and college. And I've had my knees injured by just lifting too much weight and playing sports. So when you're emotionally stressed out, that affects your cortisol level. Cortisol levels, when they go up, cause inflammation. When inflammation goes up, it's going to cause pain in the weakest links in your body. So there could be an emotional component. So assess that, number one. The next time you're stressed out, do you feel your pain increase with that? Try some stress relieving breathing exercises. Like I talked about, the box breathing exercise. That's a powerful one to do. There's a technique called tapping technique. You literally can go on YouTube and learn tapping technique, and it's a simple emotional freedom technique that can relieve the emotional stresses. We know that emotions are real measurable things in the body, and when our negative emotions go up, our pH level in our body goes down, and inflammation goes up, and pain goes up. So get to the root cause of your stress and deal with that, and understand that most of the times we overthink things, we overstress on things, and when we overthink and we overstress on things, we don't solve problems. You guys know as well as I do that most of the stress we put on ourselves is completely useless. And all it does is it brings our vibration down and causes more problems in our life, including chronic pain. So I know this is a lot of information, but I want to paint a big picture to let you know that there are many, many things that you can do to help your pain. And if something didn't work, if you saw a physician and didn't work, or you tried a supplement didn't work, there are other things that are out there. And understand that health is a balance of physical, chemical, and neurological well-being. And measuring those things are super important. And there are many opportunities that you can even measure a lot of this stuff online on your own at the convenience of your own home. I know it's difficult to find functional medicine practitioners, but listen, if self-care is the new healthcare, and it is, you have to learn how to take care of yourself. And I think that precision testing and precision therapeutics for your individual need is so important. So I hope, Mike, that helps answer your question. And I just want to thank you for tuning into this Pep Talk podcast. I hope that you found today insightful and empowering. By the way, don't forget to like, subscribe, and share our page with your friends and family. If you have questions like this about health and wellness, go to PEPTALK.WORLD. That's PEPTALK.WORLD. Type your questions in there, and I'll answer those live on these Pep Talk podcasts. So, folks, until we meet again, I'm Dr. Eric Nepute. God bless you, God bless America, and God bless the world. Stay smart out there, folks. And remember, self-care